He is presently the head of the Aquatic Wildlife and Laboratory Animal Specialty of the College of Veterinary Surgeons, Nigeria. He has over 50 scientific journals, award-winning conference papers, and technical reports to his credit. Dr. Oladosu is also a pastor in the Redeemed Christian Church of God. He's married to a veterinarian, and both are blessed with a son. So, Dr. Oladosu, you are welcome to today's program.
Yeah, for those on YouTube, we couldn't stream on YouTube, so we're going to collect it somewhere and come back. It's unfortunate. So continue. Yeah.
Thank you very much.
Yeah.
Can you see the screen?
Yeah, very well. Very well.
Okay, good. Good. Good morning, everyone. Yeah. It's my pleasure to be at this seminar this morning. I think we have lost a lot of time. So I will just be very fast.
Yes, yes.
Thank you.
Yeah.
We are having serious difficulties in the aquaculture industry with regards to incidence of enzootic diseases. Since 2014, catfish hatcheries are closing down, tilapia farms are closing down. And we have fish production originating from just two major sources, the capture fisheries and the culture fisheries. We rely very well on the culture of fisheries now because it's the one that is actually really sustainable. Because in capture fisheries, we have a consistent global decline because of pressures from a lot of things that include overfishing, anthropogenic activities, climate change due to global warming, natural climatic occurrences like flooding, like drought, like those things, okay? But with the presence of prerequisite natural resources for fish culture that includes extensive inland and coastal waters, an abundant supply of cultivable fish species, aquaculture seems the only source to really rely on. We have over 300 fish species that are available in the Nigerian waters, but only a few of them have been developed for aquaculture. In the freshwater environment, we have the Claridae that includes Clarias lipinus, the Etobrancus species, that's Longiphilis and Biodorsalis, and the reciprocal hybrid of those two genera, that's Clarias and Etobrancus. We also have tilapia, Orechomis niloticus, that's the one here. You can see my cursor. The Etobrancus is there, and this is Clarias and the hybrid. We have the African bony tongue, Heterotis niloticus. It's becoming popular now because it feeds mostly on algae and plants, requiring little animal protein, so the cost of feeding is very low. We have the trunkfish, which is the Gymnacus niloticus. The common carp is not indigenous to this place, but it's been introduced years past. Pangasius is the new entrant now. There's even an entrepreneur in aquaculture that is producing in large number, large quantity, and even glass freezing and selling to people. We also have the brackish water environment, the Lujanus corensis, that's stress snapper, Tilapia guineensis, and the Chrysictis nigrodigittatus, that's this one, that's the silver catfish. It's known, it's well known that Nigeria is the second largest producer of fish in Africa, second only to Egypt. and the largest producer of catfish globally. But then, even with our annual growth rate in aquaculture production going to about 12%, which is above the global average of 8%, we are having an industry that is contributing immensely to Nigerian economy and the GDP. But there are constraints to sustainability, even in aquaculture production, because of the annual shortfall of close to 1 million tons every year, which makes Nigeria the highest importer of seafood in entire Africa. There is that need to meet the market demand. And so there is intensification of aquaculture. And of course, with intensification comes pressure that includes stress to the cultured organism. And that will engender incidence of diseases that, for now, has crippled most catfish hatcheries. And the present economic situation. But major among the constraints that we have is the incidence of disease because of the intensification to meet market demand. Of course, today we'll be discussing only infectious diseases. We cannot take all of them. The non-infectious diseases are also very important, and some of them are with us all the time. Extremes of water quality parameters, nutritional deficiency, intoxication, and the rest of it, they're there. But today we discuss mainly on infectious conditions that are endemic. And of course, all the developmental stages of fish are susceptible to various diseases. You start from incubated eggs that may not hatch, the embryo may not eventually hatch out. You talk of hatchlings, that's incubated eggs, is hatchlings there. And then fry, fingerlings, juveniles, and adults, as well as the broodstock. And of course, like I said, we have infectious and non-infectious disease conditions affecting all of them. We will talk about infectious diseases now, starting with the viral condition. The first one that we know that is here with us, it's very prevalent in the hatchery, catfish hatchery mostly, is the IPN, infectious pancreatic necrosis. As far back as 2014, during a survey of catfish hatcheries across the South-South, and even in the Southwest, we're able to discover that fry are coming down with this condition. It's caused by infectious, highly infectious virus, and it affects fry mostly 3 weeks after yolk absorption. Yolk absorption in catfish is 3 days after hatching. So precisely 3.5 weeks, this happens, and the acute form is usually accompanied by very high mortality that could be up to 100%. All the fry will just die. And the clinical signs that you see will be dark body coloration, swelling of the ventral region, particular hemorrhages of the pyloric cecum, bleeding of internal organs, and so on and so forth. But one major sign that you will see is the presence of pseudofeces, that fecal cast, is a white worm-like mucus hanging out of the anus of the fish, and as the fish swims, it trails it. And then the fry also swims in an uncoordinated fashion. So to diagnose this condition is to observe for clinical signs, especially the fecal cast, which is pathognomonic to this condition, and then the identification of the virus. I mean, in cell culture, that is not feasible because it takes a long time, 21 days, or the fry will have died. So the rapid diagnostic techniques may come in handy here. PCR, ELISA will be very will come in handy here. Prevention, of course, you know that we don't treat viral conditions, but when we maintain strict hygiene and biosecurity, we ward off the pathogen. We ensure that we procure fish from disease-free and reputable hatcheries, and then we routinely disinfect our facilities. The second one, which is infectious hematopoietic necrosis, gives almost the same kind of clinical signs that we see with IPM. In this case, between 8 and 15 days after hatching, fry starts to die. And this can give up to between 80 to 100% mortality. The clinical signs here, apart from the ones we see in IPM, will include exophthalmos and hemorrhages on the yolk sac, but also the trailing fecal cast is part of pneumonic here. If you go to the next slide, you will see the picture of, that's the fecal cast. The head of the fry is to the right and the tail is to the left. And you can see the fecal cast hanging. As the fry is swimming, the thing swims after it. Farmers will tell you that they saw worm hanging on the anus of the fish. It's not worm. It's fecal cast that is not dropping. Okay, diagnosis is also by the rapid method, PCR, ELISA, and other rapid tests, coupled with the clinical signs that you will see. But transmission for this one could be through water or carrier, even the egg of the fish. It can be transmitted vertically, that's what it means. And even blood-sucking parasites like leeches can transmit this. Prevention is like IPM, strict biosecurity. But there was an action where we tried to salvage some of the fry, knowing that the fecal cast is a product of enteritis. So we tried to treat symptomatically using flagyl to treat, and we were able to get some results, saving the ones that did not die. Let's look at the bacterial conditions now. Multi-hormonal septicemia, bacterial septicemia. This is probably the most common bacterial disease in freshwater fish, and is caused by several genera of bacterial organisms, including Aeromonas. Also, we have Pseudomonas being involved, as well as Streptococcus. In fact, recently, we isolate more of Pseudomonas than Aeromonas in bacterial septicemia. Transmission is through organically polluted waters. And even these conditions can affect many other vertebrates, including frogs and alligators. It's been reported in man to cause gastrointestinal and systemic infection too. And so that's the reason why screening ponds will be very, very important, so that frogs and alligators and so on will not transmit into a pond that is not affected. The clinical signs you see here is superficial to deep skin lesions, dermatitis, that can transcend the skin and also affect the muscles. You have hemorrhagic spots on the skin and the base of the fin. And when you have deep ulcers, you have the involvement of the muscles. And with the involvement of the muscles, it could progress to hemorrhagic septicemia with exophthalmos, ascites, and so on. And then mass mortality can ensue when you have the involvement of the respiratory apparatus. You know that in catfish, we have the gills, but we also have the arborescent organs that allow them to breathe atmospheric air. That's why the catfish is an obligate air breather. The moment these organs are affected, you have mortality. And the mortality the fish presents agonal response. The mouth will be opened, the operculum will be flared, as if the fish is asking for oxygen. If you go to the next slide, you will see the picture we are trying to show here, the arborescent organ. Right there, the arborescent organ is supposed to be bright red or pinkish in color, but you could see it's brownish, covered with some kind of fascious sheet with necrotic debris. This is one of the clinical signs that you see. Diagnosis will be by observation of clinical signs, and if we are able to isolate and characterize the cause of the agent, and then treatment will be following sensitivity, antibiotic sensitivity test. You can use the appropriate antibiotics. In cases where we have found out, we saw that simple vaccine was very effective, but you cannot do without antibiotic sensitivity to be able to treat bacterial infection. Enteric septicemia is all in the head, caused by Gbola ictaluri. The pathognomonic sign here is the presence of a lesion between the eyes that may appear like a raised area, and then it develops into a hole, reddish. It starts with the pimple-like lesion, and then it erodes, and then develops into a hole in the head. That's the picture. If you go to the next slide, you see the picture of the clarias that suffered this infection. Yeah, that's it there. You can see the hole right there. Sorry, I cannot use the cursor to show some of the things that I'm trying to show you because I'm using my phone. Okay. Diagnosis is based on clinical signs and isolation of the causal agent as well. And treatment will be, and prevention will be by maintenance of good quality water, ensuring that dissolved oxygen is good, above 4 parts per million, provide good quality feed supplemented with vitamin C, and then treat appropriately with antibiotics based on sensitivity tests. The next one is Edwardiellosis. So this is very common here. It's a disease of the channel catfish. In fact, it's second to none in the US channel catfish bacterial infection. It causes losses almost up to $200 million every year in the aquaculture, in the culture of channel catfish in the US. The etiology is Edwardiella tada, and the clinical signs that it presents is extensive lesion of the skin, the muscles, the internal organs are also affected. It's characterized by the presence of a cutaneous foci from a fistula that originates from the muscle, and then you have some malodorous smell that comes from it, probably due to liquefactive necrosis of the viscera. And if you go to the next slide, you will see the pictures of fish infected by Edwardiella tada. The one on the left shows us the dermal lesion, the grayish patch. If you are not careful, you will confuse this with columnaris disease, the saddleback. The fish hangs vertically in water, just like in saddleback. But if you check the right, the picture on the right is the accumulation of blood-tinged fluid in the peritoneal cavity. And you could see the evidence of liquefactive necrosis in the fish, in the internal organs. Diagnosis is also based on clinical signs, next slide, as well as isolation and identification of causal agents. And treatment, of course, is based on antibiotic sensitivity after you have cultured the organism and you choose the appropriate antibiotics. Columnized disease is the next one. These are endemic or enzootic bacterial conditions in the catfish industry in Nigeria. Columnized disease is also known as saddleback disease because of the typical lesion. If you look at the lesion on the dorsum of the fish, it's like putting a saddle on the back of the horse. Bilateral grayish lesion on the dorsum. It's caused by Flavobacterium columnae, and it affects all fish. All fish are susceptible to this condition. The clinical signs, apart from the discolored patch on the body, sloughing off of scales in fish that have scale, you could also have erosion of the mouth and the barbels. That's the picture of an adult fish. This is even an hybrid suffering from that condition. You can see the barbels are amputated, and the pectoral fins are already having some necrosis. And you can see this classical saddleback lesion, the grayish patch on the dorsum. Okay. This is not likely to have gone systemic, and it can be treated the way it is now. But the moment gills are invaded and the organism go systemic, it becomes a terrible situation. Contributing factors to this condition include injury caused by rough handling when we are sampling, or we are harvesting, or we are sorting. Overcrowding in holding facilities or transport facilities will also cause this. Poor water quality, especially low dissolved oxygen, will contribute to its incidence, and fluctuating water temperatures. In fact, you harvest your fingerlings on a hot, sunny afternoon, you are too sure that your fish will come down with this condition, especially when you are harvesting from earthen ponds. Malnutrition is also a contributing factor to this condition. Of course, diagnosis is based on clinical signs and isolation of the causative agent, and prevention and treatment will be through antibiotic treatment based on sensitivity test. We always emphasize that. The reason being that we have an upsurge of antimicrobial resistance, and the aquaculture industry is a major contributor to that. So let's go to fungal and parasitic diseases now. Those that we have discussed are the bacterial conditions that are enzootic in our industry, aquaculture industry in Nigeria. Fungal and parasitic diseases. Next slide, please. Fungal organisms, generally referred to as mold, they are heterotrophic organisms. They derive their nutrition from both live and dead organic matter, whether plant or animal. Although they are believed to be secondary invaders, there are some fungal organisms that are primary pathogens of fish. The most common of them all is the Sapolegniasis. That's next slide. Sapolegniasis caused by the fungal species of the other Sapolegnias. That includes Sapolegnia species, Aclea species, Leptolegnia, Phanomyces. If you look at the picture on top, the right, it's a picture of incubated eggs, dead eggs. Of course, dead eggs are good growth medium for these organisms. Okay. And the organism just grow on these dead eggs, and then the hyphae will now extend to the embryos that are alive, suffocate them, and then grow on them in kind of cycle, vicious cycle, until all the eggs are gone. So it's important that we look out for unfertilized eggs and remove them from incubator tanks, or prevent having large quantity of unfertilized eggs by ensuring that your eggs are viable even before you go into production. This condition also affects adult fish, as you see in the next slide. The infected fish carries white fluffy growth of different sizes on their body, and that's usually because of wounds on the fish sometimes, and at times the organism infect the fish directly. When you clear off the white fluffy growth from the skin, you see the primary wound that has dark red margins appearing underneath the growth. The diagnosis is based on the clinical signs, and microscopy that shows the hyphae and reproductive gametes of the organism under the microscope. Next slide. The best disinfectant for this condition is malachite green, applied at 66.75 milligrams per liter. Unfortunately, malachite green is carcinogenic and has been banned in most countries. It's not in use. And that's why we may need to shift to other chemicals that we can use to disinfect, like potassium permanganate at 0.01 gram per liter for 1 to 1 hour, 30 minutes. Gill rot is another one caused by 2 different species of the fungus Brachiomiasis, demigrans and sanguinis. What they do actually is that they grow on the wall of the gills, and they occlude the vessels, the blood vessels in the gills, suffocating the fish. And because there is no supply of oxygen, there is necrosis on the gills, and the gills begin to shed part of it, creating necrosis. These are the clinical signs that you see in affected fish. Based on microscopy, you'll be able to also see hyphae of the organism and be able to characterize them based on their morphology. Control and prevention is usually by liming the pond prior to stocking, using calcium oxide at the rate of 2.5 tons per hectare. Infected ponds with fish can also be treated with chlorinated lime, calcium hypochlorite, but this will be applied on surface of the water at 10 to 15 kg per hectare. It's very low dosage, 3 times a week. But then in pond where you will apply this, because chlorine and fish are never friends, the depth of the water cannot be less than 1 meter. You can also apply antibiotics to prevent secondary bacterial infection. Parasitic diseases, if we look at protozoan parasites, flagellates first. One very common protozoan flagellate, it's Costia necatrix, also known as Ichthyobodo necata. So this condition is either costiasis or ichthyobodiasis. But the organism can occur as free swimming, but it can also attach to the skin and gills. The pathogenic ones can attach to the skin and the gills, the epithelium of those organs. They are found mostly on those 2 sites. Those are the projection sites for this particular organism. And what they do there is cause irritation, divert the attention of fish from feeding. And it can be dangerous to young fish, and you can have massive mortality from this. Diagnosis is by microscopy of the skin or the gills, biopsy, and you see the piriform shaped organism that moves by a staggering movement. Treatment is usually 1 hour immersion in 250 parts per million of formalin for 1 hour. Cryptobia is the next one. Cryptobia brachialis is a protozoan gill parasite having 2 flagella, one directed anteriorly and the other posteriorly. If you are not very careful, you will take this for trypanosome because it also have a short undulating membrane that connects the 2 flagella. They are found mostly on the gills of infected fish in polluted waters with mild pathology. Treatment is accomplished when you use formalin in immersion treatment at 250 parts per million, also for 1 hour. Trypanosome also occurs, especially where you have the presence of leeches in the ponds. The parasite, which also have undulating membrane like the Cryptobia, have only 1 flagellum that is unidirectional. It's directed anteriorly. It's transmitted by leeches. The parasite develops in the gut of the leech into large number of the infective stage, and then it's transmitted to the fish while the leech is feeding on the fish. Of course, we know that leeches are hematophagous parasites of fish. We'll still discuss them. Because this organism has the blood-forming tissues as its predilection site, it causes anemia, severe anemia. You can even have paper white gills that are supposed to be bright red normally. And the only known method of prevention is to control leeches in your ponds. We have another one, hexameter. I'm trying to rush through. I hope you don't mind, so that we can catch up on the time that we have lost. Another flagellate parasite of fish is hexameter. It's a pear-shaped protozoan parasite with 8 flagella, 6 directed anteriorly and 2 directed posteriorly. They're often found in the gastrointestinal tract. Even in clinically normal fish, you can find them there. But primarily, they infect the anterior intestine and the pyloric ceca. But they can spread to other organs like the gallbladder, and they can cause high mortality. Fish will begin to lose weight, having relatively large head and very thin body, presenting structure of a pin, and that's why the condition is called pinhead condition. You could also have accumulation of fluid in the abdominal region. Diagnosis is by observation of the trophozoites in anterior intestinal scrapings and in fecal samples. You will see the trophozoites there, as is shown in the picture on the left. Okay, treatment is with metronidazole flagyl at 5 mg per liter by immersion for 3 hours. But you can also add in the feed at 100 mg per kg body weight. Calculate the total biomass, and then you use it to calculate the total dosage, and then you incorporate this in the diet that they eat every day, and you do that for 3 days to take care of this condition. Ciliate protozoan parasites, the first one is tetraaminosis. It's caused by a protozoan ciliate called tetraamina. The most pathogenic is T. colici. Is a free-living aquatic. Most of the species are free-living in aquatic environment, but that pathogenic one can invade the skin and the gills, penetrate the skin, causing ulcerative dermatitis. They can also invade muscles and get into internal organs as well. It causes muscle swelling, and the diagnosis is when you observe copious mucus production, dermatitis, and muscle swelling, and you can demonstrate the organism in wet months of the skin of the gills, and also in the internal organs. The treatment of this condition is the use of formaldehyde bath if it has not gone systemic. Once it goes systemic, it's difficult to treat because it invades the muscle and internal organs. The next one is trichodina infestation, trichodinosis. This is caused by Trichodina species. It's also very common parasite. Yeah, even when it looks, cause heavy infestation can be a real problem to young fish, especially fry. You see this mostly in poor environmental condition, and they take advantage of the debility caused by poor nutrition to invade the hosts. We have many trichodinids. Trichodina is one of them. Trichodinella, Tripatiella, Dipatiella, Paratrichodina, Hemitrichodina, and Vocomia species. They all the same. They have the same structure. The presence of the parasite on the skin or the gill biopsy will help diagnosis. Except for research, you don't need to identify to species level. They all succumb to immersion bath in formaldehyde at 250 parts per million for 1 hour. 250 parts per million is actually 1 ml of formalin in 4 liters of water. 1 ml of formalin in 4 liters of water. But you can also treat using salt, 1% salt for 10 minutes, or 2 to 3% percent of salt for 5 minutes. Will also take care of the parasite. Cynodonellosis is the next one. Cynodonella, caused by Cynodonella species. 2 of these species are pathogenic, vesicular and exastitia. They are pathogenic for fish. They are disc-shaped organisms with concentric rows of cilia. They infest virtually all freshwater species, mainly young ones, fingerlings. Though this parasite exhibits strong cellular response suggesting the invasion of the epithelium, severe damage do occur sometimes before you see gross pathology. Condition can cause skin ulcer and make the skin to look tattered. The appearance will be tattered. Diagnosis is based on observation of the parasite in wet months of skin smear or gill biopsy. And then the organism, which has a flat shape with several bands of cilia, cannot be mistaken with ichthyopteros because of the presence of the horseshoe-shaped nucleus in ichthyopteros, but they look alike. Okay, and ichthyopteros is also a ciliate. I have not found one in any fish in Nigeria in the last 30-something years of my practice, although I've had people say they are in ichthyopteros. Treatment of this condition is immersion bath in formaldehyde, 250 parts per million for 1 hour, or salt bath, 1%, for 10 minutes, and 2 to 3% for 5 minutes. Epistelis infection or red sore disease is the next one. In fact, it was surprising that I found these in an intensive rearing system that is a water recirculation system that has UV irradiation as a disinfecting facility attached to it. It's common, very common sensile colonial ectocommensal ciliate. Sometimes it's in mixed infection with some gram-negative bacteria like Aeromonas to cause red sore. That's when it's referred to as red sore, when you have concurrent infection with bacterial organism. The complex is very common in pond-reared fish. Ordinarily, these organisms feed on bacteria and other small food items that are present in the water. They use fish as surface of attachment for stability, and their presence is mostly indicative of water that is organically polluted, having high concentration of bacterial organisms. They produce white or hemorrhagic lesion, that's the red sore, on the flank of the fish, on tip of bony prominences like the fin, the jaws, the opercular plate, on which they attach. They may also infect the oral cavity and the gills and the nares. The skin is ulcerated whenever wherever they are attached. Lesions always have bacterial infection. Like I said, mostly Ehrmonads. Diagnosis is based mostly on microscopy, revealing the typical stalked, non-contractile zooids, and the zooids also have C-shaped macronucleus like Ichthyopteros, but the features of these two organisms are different. So there's no way one can mistake one for the other. If the stalk detached, it could be mistaken for fungal hyphae. So, but the moment you are able to see the entire organism under microscopic view in some other fields, you will be able to know that this is not fungal hyphae. Treatment is the use of immersion bath, 2 to 3% salt, 10 to 15 minutes. Organisms of this pathogen is sometimes resistant to formalin bath, but salt has been found to be very effective. Myxozoan parasites. The myxozoa parasites of fish are mostly of the class Myxosporia. They are obligate parasites that invade tissues, histozoic form, or organ cavities, holozoic forms. They occur as spores, the presence of polar capsules, as you see in the diagram on the right-hand side, that contains polar filaments. They are mostly intercellular, but some can be intracellular, and they are usually site-specific. Taxonomic identification is based solely on the spore structure, including spore size and shape, and the number and position of the polar capsule. Young fish are most seriously affected, especially in heavy infection, by the histozoic form, the ones that invade the tissue, severely causing severe tissue damage. The first disease caused by this set of organisms that is common to us is Wilding disease. It's a chronic debilitating disease characterized by Wilding movement. The fish will be chasing its tail, so it will be moving in circle. It's caused by Myxobolus cerebralis, it's also known as Myxosoma cerebralis, and it's been reported worldwide. The first time I came across this was 1994, but I found the organism in nodules, dermal nodules, tiny nodules, pimple-like nodules on Clarias lepinus. Young fish are mostly severely affected by the parasites, with 100% mortality in hatchlings or fry. But sometimes you have little or no clinical signs in adults that are as old as 6 months. However, the cartilage and gill arch may be infected in the adults, making them carriers. Sometimes you can have deformity of the bones of the mouth. Pathogenesis, spore release in the fecal material of affected fish or that of piscivorous birds are ingested by annelids, intermediate hosts, such as the sludge worm, that's Tubifex. The parasite completes both sexual and asexual development in the worm, and the actinosporia into which it transforms either penetrate directly the new hosts or is ingested with infected worms. Parasites now then invade and feed on the cartilage of the exoskeleton, the head, the gill arc, leading to spinal curvature that could be lordosis or scoliosis. There can be distortion of the jaw, just like I said. The head can be deformed. Involvement of the cartilage of the auditory capsule is the one that leads to the characteristic whirling movement. Acute mortality is observed without clinical signs, sometimes has been found to be associated with heavy parasitic loads. Diagnosis is based on clinical signs, observation of spore in wet mud. The picture on the right is the one I got from nodular lesions of the skin years back. Treatment is very difficult, but the parasite can be eliminated from culture facility through thorough disinfection with 25% on slicked lime at 380 grams per square meter. Even in earthen pond that you have 3 cm silt, that the mud is that thick, the lime will be very effective. But it's important that you quarantine new fish entrants to the farm, procure your fish seeds from reputable hatcheries, also your broodstock from reputable hatcheries. And then the dead fish should be promptly and safely disposed. Some farmers have the practice of engage in the practice of feeding their fish with dead fish from their pond. That's not safe with this kind of condition. The next condition is tapioca or milky flesh disease. Tapioca or milky flesh disease that is caused by Enzootic species. The lesion reduces the aesthetic value of affected fish, and that, of course, will result in economic losses. The organism is Enzootic, invading the muscle and other tissues of the fish. The spore of Enzootic is usually ellipsoidal in shape, having 2 polar capsules and 2 elongated caudal appendages, as you see in the picture on the right. I also was able to isolate this from some fingerlings of Heterobranchus biodorsalis some years back. And in fact, what we did was to destroy the entire stock then. Not all Enzootic species will cause disease, but some are of economic importance. They invade the gills, the skin, and the musculature of the fish host. Observation of pseudocysts on the skin that contain typical spores with the long caudal appendages is diagnostic, together with the clinical signs and the lesions that this condition will cause. Treatment is difficult, but outbreak can be controlled the same way that we have explained for myxobolus infection, whirling disease. Coccidian parasite of fish, coccidiosis. Coccidian pathogens of fish are mostly histozoid parasites affecting solid tissues, though some of them can be hemoparasites like Hemobarbariana and Babesioma. They are typical examples. All tissue coccidia that infect fish belong to the family Hemeridae, Hemeria, Epihemeria, Mesospora, etc., with over 200 species identified in fish. The infective stage is the sporozoites, that is, following injection reaching the target organ. intestinal infection is usually asymptomatic. Sometimes accompanied by epithelial necrosis. Intestinal tissue results in lesions that accommodate in destruction of the affected tissue. And the common sites that can be invaded include reproductive organs, liver, spleen, the swim bladder. And the diagnosis of this condition is based on observation of dysregulated oocysts. Histopathological identification of the different developmental states can also be diagnostic. Treatment is immersion bath in 0.63 ml of 9.6% amprolium per liter of water for 2 days. Immersion bath. This can be very effective. Metazoan parasites. Metazoans, that's the next species of multicellular organisms that parasitize fish, and they infest practically all organs. They can occur on external body parts as ectoparasites, the skin and the gills, and internal organs as endoparasites. The size of the parasites can range from 1 mm to several tens of centimeters. So they can sometimes be observed with naked eyes. However, use of microscope is required for clinical examination of infested fish. The first one we'll be talking about is the monogenic trematodes. Monogenic trematodes. Yeah, hermaphroditic flatworms found mostly on fish and occasionally aquatic invertebrates. They can be found also on aquatic invertebrates. They are found commonly in gill chamber of the skin or organs communicating directly with the exterior, like the cloaca, the nose tree. So their development is without intermediate host. That's why they are monogenic.
Yeah, it looks like his glitches has come back. I hope we're getting everything whole and entire. I hope we're getting it whole and entire. He will come back. Don't worry. We are patient. We are patient. He will come back. I hope we are getting the pictures, because as veterinarians, we need to know the nitty-gritties of this. And I believe we should have a new curriculum, like Chika said, on fish medicine. Starting from anatomy, physiology, biochemistry, down to pharmacology, parasitology, pathology, now to medicine, clinics. So I think it will graduate us very well, and we need to develop a good curriculum. And most of the fish we eat in this country is coming from China. In fact, 85% of tilapia we eat in this country, those you see in all these in barbecue joints, most of them are from China. So you see.
Hello?
Continue, sir. I just had to fill the gap.
You can hear me now.
Oh, yes.
I had your observation. Already at the University of Ibadan, we start from anatomy of the fish. And we go through the whole gamut before they eventually arrive at the medicine. So we teach the anatomy of fish, the physiology of fish, and then pathology, and then they come to medicine. I agree with you that we need to get this done. If you can click on the, are you able to click on the picture on the right?
Yeah, we are seeing the picture.
Yes.
It's a video.
Yeah, it's a video.
It's
I must have played the video.
Yeah, you can play it.
I must have played it.
You can play it. Just click on play.
Yeah. I think it's having some difficulty. I must say click on.
This is
Maybe my laptop doesn't have the facility to do that. I'm clicking on it. I can see the icon, but it's not playing.
Yeah. It's not responding. No,
yeah. Not responding. Yes.
It's okay.
Oladosu, okay. Can you respond at your end?
Hello?
Can it respond at your end?
Let me see whether
no. No, because it's from there that you are sharing. It's not working.
No,
but don't worry.
Can share. You can share.
It will have shown us the foraging movement of this parasite, and we'll be able to see clearly. If you look at the picture very well, you will see that this organism has inside it an embryo with the hooks. And that embryo also have an embryo in it. This organism can have 3 generations in one, which and gives birth to the young ones alive. Makes it very dangerous. Gyrodactylus. But the dactylogyrus is oviparous. That one lays eggs and also infect the skin. But the dactylogyrus infect both the skin and the gills, and they are very, very dangerous. In fact, in most cases where you have bacterial infection, you also have this parasite. And if you go to the next slide,
I must say, share the next slide.
You are no longer sharing the slide.
You are not more sharing. I must say it's having glitches. Mine, I'm having. Thank you, Oladosu. Honestly, we are honored to be with you. I think it's a good thing that you're a veterinary doctor like us, but with a difference, colored and flavor difference. I think your pedigree from the Institute of Marine and Oceanography, I think your pedigree must have prized you, added some value to you, sir. Don't you think so? Hello? Oladosu, are you hearing me?
You said, yeah, I'm hearing you now. You said what?
I said your pedigree from
yes.
Institute of Marine and Oceanography must have put you on top of your value today.
Yeah,
that's walking from the field to classroom. Has it made any difference?
Helped a lot. It helped a lot. It helped a lot. I made up my mind right from my final year in the school that I'm going to work with fish. So I targeted the institute for my for employment, and I was successful in being employed there. And the moment I got in, I established a fish disease lab. That was the first thing I did. I established a fish disease lab, and as God will have it, we had visitors from Germany who shared the project with the Institute of Oceanography, Calabar. They came to procure fingerlings from us. And then they saw the disease lab and they thought that they should encourage me. And that's how I found myself at the State Fish Epizootic Control Service of Lower Saxony to broaden my knowledge in fish disease.
Okay, continue. Continue. We have a section for this. Oh, continue. Okay. Just for the interlude so that the slide will come. The slides are on.
The slide is already there now.
Yes, sir.
Okay. So, like I was saying, if you go to the next slide, you will see the electron microscopy of the organism and how it attaches to the organ. Next slide, next one, yeah. The picture on the left. They attach to the skin and the gills using their hooks and hooklets. And you can see the traction on the organs that they attach. They provide a portal of entry for secondary bacterial invasion. And that's why in most cases, with this kind of parasite, you always have bacterial infection following. Heavy infestation itself can result in mass mortality for young ones. And treatment for this condition, the monogenial trematode, is usually with formalin at 250 parts per million for 1 hour. I have always used this and it has never failed. Leech infestation. Of course, we know that leeches are hematophagous organisms. They suck blood and also transmit trypanosomes. Of course, on both ends, what happens is that you have a loss of blood leading to anemia and, of course, mortality due to that. Like I said, we have a situation in which gills were paper white instead of pinkish or bright red. But leeches can be controlled from ponds with application of the lime. You can also apply large single dose of organophosphate, triclophon at 2 milligrams per liter, and they are conclusive. Okay. Diarrhea trematode infection. Only recently, because of the presence of aquatic snail in some ponds, we decided to go into investigation of the possibility of the presence of Diarrhea trematodes. And of course, from fish that are in such ponds, you are able to the presence of Metasarcaria sharing the eggs. We had mass mortality observed in juvenile catfish in some of these ponds with prolapsed gills, necrosis of the gills, as well as gill swelling, and serious distortion of gill architecture. Next slide, please. Yeah, serious distortion of gill architecture because of the massive presence of Metasarcaria. When we check the snails, we are able to also find presence of Sarcaria that possess long tapering tails, oblong body, and white 2 eye spots from melanoid scales that are in the pond. I don't know. The pictures are not. Go to the next slide, please. Next one. Next slide.
Go down.
If you continue clicking, the pictures will be coming. Yeah. Yeah. Okay. Yeah. Okay. Click again twice or 3 times. Yeah, that's the pond where we have the melanoid snails, aquatic snails, and those are the snails that you are seeing there. Click again, and then you see the Sarcaria from the snails. If you click, yeah, that's the Sarcaria from the snails, and then this will invade the fish, and you have the Metasarcaria in the gills. And they proliferate and destroy the gill architecture, causing severe respiratory and osmoregulatory problems with mass mortality. The condition is difficult to treat. It's important to control snail intermediate hosts with molluscicide like copper, slick lime, or belucides. You apply molluscicide, then deseal, and we apply again. Belucide at 1.1 kg per hectare. Slick lime, that's calcium hydroxide, at 2,000, that's 2 tons per hectare or for pond disinfection, but there should be no fish inside. It's just to disinfect the facilities. Treatment of larval stage using praxiquantel could also be effective. But we prevent incursion of aquatic snakes into pond by screening. You can screen the inlet of your pond using nets so that no snail will be able to come in. Crustacean parasites, mostly copepods comprising of seal owls, anchorworms, that's Caligos species, pseudo-Caligos species, lemna. They are the pictures on the right. They occur in various sizes, from barely visible to 10 mm. They attach to the skin and the gills, the oral cavity, inner opening, and they cause erosion and separation. Caligos can attach to the penetrate the skin, causing hemorrhage, hyperplasia, fibrosis, and it can also provide portal of entry for secondary bacterial invasion. Diagnosis is based on examination of skin scrapings, observation of these parasites on the skin, histology of the skin may be required in lemna infestation because it burrows into the skin. Treatment with organophosphate diclofos bath at 0.5 to 2 milligram per liter for 30 to 60 minutes. We cure the copepods infestation. But the treatment will have to be repeated every 7 days for 28 days. That's to get rid of the larval stages, both on the skin and in the waters. And to round up, let's look at the general principles of disease prevention and control. To control disease condition, you have short-term therapy. That's when you apply chemotherapy following microscopy, culture, and sensitivity, especially with antibiotics when you are talking about bacterial infection. And the chemotherapy can be applied or administered by immersion or orally, but you must ensure appropriate concentration time ratio when you are using disinfectants like formalin, copper, acrylflavin, potassium permanganate, and the rest of them. Incorporation of drug in diet should be done taking the feeding rates, the total fish biomass, and drug concentration into consideration to be able to arrive at the appropriate dosage that will take care of the condition. When you are talking of deep treatment, is a short period bath. So you don't have large volume of water and you bath the fish in. No, you take the fish in the net and you dip because it's just for a short while so that there will be no intoxication. But in long-term therapy, which is basically biosecurity, is to take care of all factors that may contribute to the incidence of the disease. Of course, you know, diagnosis is a systematic elucidation of all the factors that will lead to the disease. And of course, treatment will have to take care of all of these factors. Otherwise, you apply chemotherapy, and then you find out that the other factors are still there, and you have the occurrence of the condition. So biosecurity measures like ensuring good water source and managing your water, ensuring good feed source and quality, feeding adequate amount of feed, and then ensuring proper disinfection of the facilities using appropriate disinfectants, prompt disease treatment, prompt and safe disposal of dead fish, ensuring personal hygiene of personnel, putting a quarantine facility in place when you are getting fish from outside so that you don't import disease together with the fish, and then restricting visitors to your farm, especially if they are associated with fish production. You need to also engage pest management practices ensuring appropriate stocking density. If the stocking density is too high, the standing stock is too high. One can have accumulation of organic material, which will also predispose to disease. Proper fish handling to avoid wounds on the fish. Pond screening against predators and vermins. Pond disinfection and safe pond enrichment. People enrich their ponds with poultry dung, with cow dung, and the rest of it. It has to be done safely. Pond management practices also will be engaged. After each harvest, you need to disinfect your pond, but that will not be done effectively if you don't desilt, you don't remove the mud, which of course may also have a lot of pathogens in them. So it's important that pond is desilted. You can see the picture of, if you go to the next slide, of desiltation in progress and desilted pond, if you go to the next slide. Okay. Now you strain your ponds against vermins and also predators like frog, alligator, monitor lizards, snakes, and so on and so forth. And you procure healthy fish from reputable hatcheries. Procure healthy fish from reputable hatcheries. I've seen people fight over fingerlings and juveniles. Please go to the next slide. Next slide, please. Next slide.
Yeah.
Can you hear me?
Yeah.
Yes, thank you. Look at the picture on the right.
No,
you can see that the fish
he has left that. He has left that. Let it go up a bit. Is it this
You can
one?
see the picture on the right. These are juveniles of Clarias vipinus. You can see the grayish patches on the body. And I met people fighting over this because they deposited money for juveniles and they want to collect by all means. They were fighting over this. Of course, once they get to their ponds, this will begin to die. This is clinical sign of columnar disease just developing. And of course, it will wipe out close to 80% of their stock. So we can do further reading looking at Noga and Brown. That's next slide. Noga is very comprehensive diagnosis and treatment of. I think I bought a copy of this 1991 in Germany, and I still have it, but it's online. It's online. I can share that, send it to the organizers so that they can share with the people while sharing the PowerPoint. Thank you very much for your audience for listening to me. I hope I've not succeeded in boring you.
There's one.
I
think is it a frog or a toad?
And thank you for inviting me.
Yeah, Oladosu, there's this frog or toad slide.
I'm done.
Yeah, we need to hear something about this. Go up a bit. Yes, what's happening here? This. Hello.
Hello, sir. Is it this one?
Yes. What's happening here?
Now we are talking about pond screening.
Okay.
Pond screening. If you look at the picture on left on the top.
Yes, reptile.
We have net covering the pond. Even though the pond is unwieldy, you have a lot of grasses there. But you have net covering it to screen it from vermins and predators. Look at frog and monitor lizard there. Okay, this actually is on a particular farm, and it's on the same farm that we have this net screening that we got these frogs and monitor lizard. Okay, these are
go up a bit. There's another
animals
slide
that can also bring pathogens into the pond.
Okay. Okay.
They can also be infected with aeromonas and bring pathogens into your ponds, apart from the fact that they can prey on fingerlings.
Okay. Okay. There's another slide up. I will say, send him up a bit. After that, then Shade will talk, because Shade will soon leave us. No, up. He has go up, yeah? Go up a bit. What are we to say here, sir? Oh, you've left. Go down ahead. Dr. Oladosu, what are we to say here? Pond desiltation to remove organic, okay? Okay, I think it's... Has it gone? I will say, has it gone? Okay, it's here. Oladosu, unmute yourself. Unmute yourself.
Can you hear me now?
Yeah, we are hearing you. What have you to say about this? Before we call it,
yes.
Yes.
The silting, once you rear fish, especially catfish in earthen ponds, because they also burrow into the base of the ponds, and because you have the rains that could wash soil from the dikes sometimes into the pond, you can even have some of the dikes falling into the ponds, and you have uneaten food and fecal material of the fish mixing with this. Is a good growth medium.
Okay. Yeah. Dr. Shade, is she still with us because she will soon go?
So after every test, we call it the and then you need
Yeah, we are still struggling. Dr. Shade, hello? Dr. Shade?
I think network is fluctuating.
Yeah, it's fluctuating, but you are getting it right now. So say that thing you say again.
Yeah. Yeah.
Say what you said again.
That we have to deseal the pond to remove the silt that presents a rich growth medium for pathogens.
Okay.
The picture down is a desilted pond that has been that we have concluded desiltation. But up, you see a man there with shovel that was trying to desil that pond. It was after desilting the pond that we have the one down. In actual fact, this is my farm.
Oh, that's your farm. Okay. Congratulations. So, Oladosu, thank you very much. But on a quick one, we'll call Shade, if she's still around, to pass some comment, because she's one of the moderators. She's about to leave us. I don't know whether she has left us. Shade
is there, Dr. Shade Ajasin.
And Shade Ajasin, don't mind me. Shade, unmute yourself. Do you have anything to say before we move on? Shade? We're not hearing her. Dr. Oladosu, you know Shade?
Of course, yeah.
Good. Okay, good. She's in fish, but there's more plantation. But do you know Dr. Chika Ikogu?
Of course.
Okay.
We all are in the same area of specialization, so we know each other.
Do you have any organization on fish in veterinary medicine?
Yes.
You have
the Association of Aquatic Veterinarians of Nigeria.
Can't it
AAVN, Association of Aquatic Veterinarians.
Isn't it possible to help veterinary council to develop veterinary education? in fish.
In fact, not too long ago, less than a month, I presented a training seminar for the VCN,
okay,
for the Veterinary Council.
Okay. Okay.
I don't know whether most people didn't get to know about this. It was
Okay.
well publicized.
Okay.
And I think there's an organization from US, Intervention for Veterinary Education, also partnered with Veterinary Council and AAVN for that seminar.
Go, because you see, part of why we are here is how we will resolve stitching our brains together and be able to move forward. That's why we are, that's why we're engaging ourselves as a non-state operator, so that we can integrate from every level to any level. The Bluebird, I've sent you an invite on Bluebird. You've not accepted it. In that Bluebird platform, you might have known about Animal Diseases Act as amended in 2022. It was where we mobilized funds and mobilized personnel. Mobilized personnel to amend that law.
Okay.
And we have 5 vice chancellors, former 5 vice chancellors. I can give you their names in a jiffy. DVOZA is there. J.D. Amin, who is a 2-time vice chancellor of Meduguri and the Duse. The founding VC of Duse is there. My lecturer, Fakaye is there. Ambali is there. Asuzu is there. 5 former, and then we have an incumbent vice chancellor of Dr. Another Suleiman Ambali. This is another Ambali of University of Ilorin. So it's a compact of people, and coppers are there. In fact, the president of the students' wing of MVMS is there. What we want to do is to bring out a place we can harness ourselves by discussing and distilling and brewing out information, because information is key. I will tell you, 85% of tilapia fish we eat in Nigeria is from China. That one I know. I'm knowing why our economy is dilapidated.
Oh dear. There's a reason for that. There's a reason for that.
What's the reason, sir?
Well, most of the tilapia farmers, they have an association. They call themselves Tapan. I'm very familiar with them. Only recently, I was with them also on a seminar in Ibadan here. They engaged in cage culture, and they were producing massively. They engaged in cage culture, but the roads to all the lakes, reservoirs, and gorges that they are using is very bad. And they were pleading to the government to help them with the roads. Some of them have investment close to 40, 50 million. Cages, badges, residential facilities that they put in place that they could not go back to work with. Onyo Dam is there, Ikere Gorge is there. Ikere Gorge is the worst. We have close to 40 of such dams in Ibadan, in Oyo State. That is lying fallow. Nobody is using. We are interacting with the government to see if we can.
The issue is this.
They are producing, and we have the good quality tilapia, genetically modified by selective breeding that are fast growing. I have some on my farm that can grow to 1 kilo. But all these facilities are just lying there fallow, and nobody is doing anything about it. And people are blocking others from having access to these things. I don't understand. I can't understand.
You see, we are now on the crucibles of moving forward once again, because of this Federal Ministry of Livestock Resources or department that is being formed. Unfortunately for us, we have some of our members in that committee, and they are now trying to brew and distill out document. We will send our discussion to some of them to listen and see what we can do, because you cannot throw it all, cannot throw your all, but you can throw little out to gain more. And that's where investment, leveraging the logistics of investment. You cannot be an investment heaven if the logistics of getting at your investment is in dilapidation. So these are things we will discuss and talk. The current permanent secretary, I will send this video to her to look at the comment of the Minister of Livestock Resources, so that, you see, we will bombard at many fronts. Management and leadership and government is down to top and not top down. It can only be top down in a dictatorship environment. All this one we know. So we will, but I want you people to, if you have an aquatic whatever association, do you have an aquatic veterinary association?
Yes.
You have. Good.
Yes.
Yes.
Association of Aquatic Veterinarians of Nigeria.
Can we have a document? Can we have a document we can offload within the next 1 week? Because they're giving 2 weeks. Have a document to hand over to
Definitely. We have documents.
Okay, can I have the document? I can send it. I know.
You can. I will discuss with the people that are having documents. I'm not too sure if Dr. Jasin is still around.
She's still. I don't think, she told me
Dr. Chika also is one of us.
Is around.
Document to be with Muiwa Benedict.
Dr. Shade is around. Dr. Shade, do you have anything to say so we can move forward? Because you want to drop out. Shade?
Maybe she's having the same problem I had initially.
Shade? Okay, if you can talk, we'll give you audience, but we'll continue to. And then there are some questions that came up. Yes, there are some questions that came up. You see, there are some questions nitty-gritties like chemistry, by dilution principles. You can read it up to make it up. Somebody, but let me just for to respect the person. Some what do you call it, in qualitative analysis, you can deal all these things because we did chemistry, baseline chemistry. He said 2 kg of salt in 100 liters of water. Is that what you mean by 2%? And I think it's not. Hello, but you can. Hello.
No. It's 2 grams in 1 liter.
It's 2 grams in 1 liter. That's all I want you to say.
Grams.
Yes, this thing borders on chemistry, water dilution chemistry. So please, that's it. Then I've seen the pigmentation of fishes, catfishes. You see fish becomes transparent from the opaque nature it's supposed to be. Do you know much about that? Can we hear you out for that?
I don't understand. Naturally, or
not somebody changes the fish or whatever to water and you start seeing the pigmentation. The fish turning to albino. What looks like albino?
Yeah, sometimes we have such. Sometimes we have such. Depends on the type of. For example, when I do production of hybrid, that's a cross of clarias and heterobranchos, we have some albinos. Okay. And the environment of the water also of the fish. The environment of the fish. When you keep fish in, for example, white plastic vat, as opposed to dark fiberglass, they have lighter body color. That happens.
Somebody is saying, is there a standard fish disease curriculum for veterinary students in Nigerian veterinary school?
We have curriculum in University of Ibadan for both undergraduate and masters. Approved.
So that does it mean that your curriculum is not across the board? That every university should generate its own curriculum. Is that what you are telling me?
Well, every university reviews the curriculum for different courses every five years. Is it 3 years or 5?
Which means it's not an NUC guided or VCN
NUC
guided.
is just trying to do that with CCMAS.
Okay.
They are just trying to do that with CCMAS, but it wasn't the case before. But
the VCN can regulate the training. That is possible. As empowered, can take it up. And then, because you see, there are a lot of sterile, a lot of fertile areas in our industry that we have not even near, I don't think we have ventilated up to 40% of the fertile areas of our industry. And that's why you can, and that's why you can have intruders from outside. And it doesn't make economic sense. And those who are promulgating or generating our policies should look at the economy, the local economy, and being able to, and as you see, I discussed something here with you, and I was asking you this question, whether your outside experience, whether it is tangential to the experience you've offloaded to that, and you say yes. You said yes, and I know, we all know, because you are talking from a pedigree. And there should be a link between the town and the gown. Yes. There should be a link. And so that the two of them can cohere. I don't find reason why, if in medicine, I have an auntie that is a doctor. She's been practicing veterinary, so she's practicing medicine since 1972. Most times she's part of, what do you call it? She's part of the external assessors in the medical school. She's a part of external assessors to students. It's not an inbuilt, it's not an encased thing. That's not the way to go. We need to break out to shilling. I don't know whether I'm making some point.
You are.
Because we see a lot of things in the field and it's being interpreted in the schools. Some research information is supposed to come from the field. And I still insist on that. We are not in the research lab, but we can give you information that will guide you inside the research lab. Like all these things we are trying to enunciate today. And we are seeing that fish medicine is different from standard veterinary medicine, from what you are telling me today. It's far. The organisms, maybe they belong to the same genera or class, but they're not the same. They're not. It's a different area. Like me, I can anybody that is good in equine medicine can practice horse medicine and giraffe medicine. So you know what I'm trying to say, because there's a meeting point. Fish medicine and other medicine, the meeting point is so narrow. Who is this? Please change your name. Who is that iPhone 976-819? Unmute yourself and say what you want to say.
Good afternoon, everybody. Oh, DBC, sorry, you said Dr. Amaka Moneke.
Okay, Moneke, change. Yeah. Okay, I'll change your name. Don't worry.
I was one that asked a question with regards to a fish disease curriculum in Nigerian universities, in veterinary schools, because while I decided to ask this question is, I know I went to UNN, and I can't remember being taught anything about fish. Maybe that was back in the days. But I ended up working with fish when I went to Canada and to Atlantic Veterinary College. And I was surprised at the amount of emphasis on fish medicine and the large economic potential that was there, or that is there. As a vet, although it took me another 6 months of my time, 6 months to study fish, both the anatomy, physiology, and everything, to be in line with what I was required to know in terms of my knowledge about fish. But coming to Nigeria, I found out that, there's an increased demand and there's a lot of aquaculture going on, but it looks like the veterinary school is not really catching on this phenomenon in terms of taking it on board and making it like becoming a dominant player in that area. And that was why I asked whether there's a standard. I've not been to Nigeria.
Yeah, I answered you, there's no standard curriculum, but they just develop their own. Any other one. And that's what we are fighting.
Yeah.
So that we can have across the board. It will be university wide.
Yeah.
It won't be, and then Oladosu, Chika, Sansi, supposed to be leading player in this industry. I finished veterinary medicine in 1987. It was a 2-day topic. The whole fish medicine was a 2-day topic by then Dr. Oladosu, late Professor Osu. It was a 2-day affair. And we found out it was McMahon that went to copy and paste on the blackboard then, because we didn't have PowerPoint by then. We all crammed it and just pour it and move forward. Because I knew I wouldn't be in fish medicine. But then my interest is coming back. But at 63, only God knows if I want to retrain myself, where on hell am I going to go? Unless I'm in oceanography, environments like oceanography, and an environment like...
It's not too late.
What? 63, Oga. My age mates are writing wheels. Hello, sir. My age mates now are writing their will. I'm sorry, that's life. That's life for you. But anyway, that's not even the issue. We have a very good fish expert, Okeme, but I don't know. Were you in touch with Okeme, sir? Gbola? Sir? Were you in touch with Okeme?
I was in touch with him. I was in touch with Okeme. He's my mentor.
No, I'm talking about recently. Oladosu, okay. Were you in touch with Okeme? Okay. Is it with us? Emeka, bring down your hand. It's not penning you. We will stream this in an online. Everybody will see it later. Don't worry. We will stream this. We will restream it. Though we couldn't go straight to YouTube, but we will restream it. But we are collecting the video somewhere. We will restream it so everybody will see the slides, whatever you want. Do we have any other comment or questions?
Somebody asked a question of what causes mortality in fry in the hatchery from 1 to 3 weeks.
He said that he mentioned the diseases involved in 1 to 3 weeks. Though you can say it again. Dr. Oladosu. Dr. Oladosu. Unmute yourself. Unmute.
Can you hear me now?
Yeah, we're hearing you. Yes, sir.
Yeah.
The thing tripped off, so I wasn't able to hear you.
Yeah.
So is there any question?
Yes, there's a question.
Is there something you want me to attend to?
First, is it the fingerlings? Is it first 3 weeks? What causes mortality in first 3 weeks?
Those are fry.
The
fry can be very, very tender, and you need to handle them carefully. They are highly susceptible to diseases there. We made reference to certain pathogens like the IPN, infectious pancreatic necrosis and infectious hematopoietic necrosis, even monogenic trematode infection, and some bacterial infection can wipe them off. If you are not having effective exchange of water, it could be a problem. If you don't siphon the debris in your tank out regularly and ensure that if there is a buildup of ammonia or nitrate, there could be 100% mortality. So active management is a whole kettle of tea on its own, different from table fish management. In hatcheries, we run water 24/7, and we also incorporate aerators. But we ensure that we clean the tanks, remove all debris, ensure there is no buildup of ammonia, there is no sudden change in temperature, no sudden change in pH, because pH, temperature 2 degrees centigrade change, sudden change can affect all your fry. A difference of 2 in pH will affect all your fry.
Yes.
So it is a big problem. One has to ensure that you have the best practices to be able to ensure good survival of your fry. I can give you an example. An hatchery, are you listening?
Yeah.
Can you hear me?
Well.
Yes.
An hatchery that has just finished rearing juveniles, clean the tank and restock with fry, only to find out that the pipes, the outlet has sludge. So the fry were dying. The fry were dying, and all of a sudden, they were near 100% mortality before they eventually found out that you have biofilm that has become sludge in the pipes that take water out of the tanks. So you have a backflow of organism each time you treat. When you treat 2-3 days, you have a respite. But 2-3 days later, you have reoccurrence because the organisms are perpetually there. So you do a comprehensive cleaning of your facilities, comprehensive, and you ensure good quality water parameters, dissolved oxygen, temperature, ammonia, nitrite. They must be optimal. These are the things.
Dr. Oladosu.
Yes.
Please, let me. You put salt inside the pond, or
not inside the pond. It's to disinfect the fish.
Disinfect the fish. You don't put it in the pond.
No salt in the pond. Salt
because you are talking about.
But lime, you can lime the pond.
Yeah.
You can lime the pond. You can apply lime
the pond, but no, you don't put salt in the pond. Are we hearing it? Because
no, we don't put salt in the pond.
Because my mind was heading to.
We don't put salt in the pond.
My mind was heading. Mine was heading.
You put salt in basins, and then you put your fish there, and you remove within 10 minutes, 15 minutes, depending on the concentration of the salt.
Yes, because
if you put in the pond, you won't be able to remove the water in 10 minutes.
You might have osmotic tension, and the fish will dry up. That's.
Oh.
Now the knife fishes. Do you know? Is it what do you call it in Europe? Is it
That's tilapia.
No, is that no? There's one you call asa. How is asa? Knife. I'm talking about knife fishes.
The knife tilapia is Oreochromis niloticus. It's tilapia.
No, I'm talking about asa. I don't know. There's one.
Asa is Gymnacus.
Gymnacus niloticus. That's
Gymnacus niloticus.
Why is it that we are not?
Niloticus. That's Ejalton.
That's what that's what I'm trying to say. Why is it that we are not mass producing it? Because it's a highly prized fish.
And has a wonderful name, Asa.
This is one fish that I've worked with for several years.
Good. Yeah.
I actually went to Imo River to study the natural habitat of this fish and how they reproduce, so as to simulate the same thing in the pond. I did this years ago. I think 1992, 1993, 1994, thereabout. I found out that, you see, if you procure the fingerlings from the wild, they don't feed on any artificial diet. They don't. They prefer to starve to death than to feed on artificial diet. And the only way people get the young ones is to go to the wild and take them from the nests. This fish constructs its own nests in floodplains where you have the grass they call Oasie species. They uproot the grass, turn it upside down, join the muddy roots one to another, and knit the shaft into a bag. How they do that, I don't know. They have no hands, maybe with their mouth. How they do that? And it's a large nest, 1 meter diameter, creating an entrance where they go in to lay, and then they stay in there and protect it. They fight anything that comes. So fishermen go there, kill the parents, and take the young ones. That was my interest. Conservation was my interest, and I've written proposals on this that have been turned down several times. And it's very expensive running a kind of research on this. So I try to find out the gut content to know what they feed on after absorption of their yolk. And I came and created that same environment in a pond and put the male and the female there, and they spawned. And I check the food that they were eating in the pond. What they do is that after the eggs hatch and they absorb their yolk, the mothers, the parents also go again, collect grass, and allow the grass to float around the nest. And midge will come and lay eggs. And the eggs will hatch, and the larvae will attach at the base of the grasses that are floating. So the young ones will go and eat it. So I realized that the only way to make them to survive is to produce that Chironomus larvae. Or produce another set of zooplankton that they can eat. Perhaps Brachionus or Daphnia or Moina. I've been on this for years. If you go to Ekpe and you want to buy a 5 kg Gymnacus, you will spend several thousands of naira.
That's what I'm saying. It's a highly priced fish.
These are fish that people take to suitors when they want to marry their daughters.
So are you keeping one for your son?
And,
are you keeping one for your son?
Sometimes I still collect. You said?
Are you keeping one for your son? Are you?
You can never tell. Oh, these guys may go where they don't need the gymnacus. If she goes to India, marry an Indian, they won't use gymnacus.
That would be what we say is tea or coffee. Okay. When you give your in-law tea or coffee,
if he needs gymnacus, he will always get. I have on the farm.
Yes. That's good. It's an area of interest. You see, our profession is diverse. Our profession, I say it and I shout it. It's not like you now, somebody telling you that the horse is sick. You'll be laughing at the person because you have an area, you are a mandator. Simple. You're a champion. Now, you spoke about administration of medications through feed. And you know that most of our feed are commercially made. How do you badge into
that? Yeah, we are.
And they are commercially made in Chika, what do you call it again? In pellets, depending on the size of the feed. So do you break them down and depelletize or pre-pelletize or whatever? Or you make your own feed?
Oh, no. What we do is this. For example, if I want to apply antibiotics, let's say, for example, I want to apply ciprofloxacin, 20% to 1,000 juveniles that are about 20 grams. That means that I have 20,000 grams of fish biomass. I will calculate 3% of that, which is the feed that they eat, and 3% of 20,000 grams, which is 2 kg. 3% of 2 kg is what they feed on every day. That's the quantity of feed that I will incorporate the antibiotics. Now, ciprofloxacin is given at 50 milligram per kg body weight. That's the dosage, 50 milligram per kg body weight. So I will calculate
he's back to a natural base. But we are patient because this topic is very, very interesting. It's not a topic you can hook off in split second. Let's give him some time to come up again. Let's give him some time to come up. It looks like he has even dropped off. But be it as it may, what we'll do is that we'll get this video before we publish it. We will edit it and hyper edit it so that it make more meaning to us. Do you have anybody that wants to talk to us? Do we have anybody that wants to talk to us? Who has something to comment? Onuga, do you have anything to say? Dr. Onuga, unmute yourself. Is there any advice you're going to give us based on what the trend, which we have been trending? Unmute yourself. Unmute yourself. Yeah. Is there anything you can tell us? Okay. Adetayo Mokolo. Can you sorry, I murdered your name. Adetayo Mokolo.
Right, sir. Yeah, Adetayo Mokolo, sir. Yes, well done, sir. Yes, I'm Dr. Tayo Mokolo from the Federal Department of Fisheries, Lagos. I'm so happy this is actually coming. I'm also with the Federal Ministry of Agriculture and Food Safety too. I'm also happy this is actually coming, and we need more of this kind of collaboration because, like Dr. Oladosu has actually stated, the aquatic industry is actually going so well and going so wide, and we need more collaboration and veterinarians to be able to be aware of some of these things, because it's an industry that is really going on and thriving presently. So we need more awareness and more knowledge in some of these areas so that we'll be well equipped. And at the same time, we also need more of these seminars and programs, because the world definitely is going towards the One Health presently now, and that has to do with collaboration with other sites in what we call the antimicrobial resistance. We know that is also being used in the aquatic industries, and the usage of some of these our drugs, you understand, and misuse sometimes. So we as vets need to also be aware of this so that we'll be able to collaborate with each other, get more awareness. Get more awareness and improve ourselves on it, so that we'll make ourselves relevant in this particular field. So thank you once again for this opportunity, and thanks to Dr. Oladosu for a wonderful presentation. Thank you so much.
Yeah, which area are you?
I am in Lagos, sir.
Huh?
I'm in Lagos, sir.
Yeah,
with the Veterinary and Pest Control Services Department. So I'm with the Federal Department of Fisheries in Lagos.
Okay.
Yes, sir.
Okay. All right. Well, What help are you going to give? Now we are coming into what do you call it?
The thing tripped off. I think my network tripped off.
Yes, your network tripped off. So, but you know what we normally do when your network trips off is that we'll be having discussions along the line.
Okay.
Okay, you can come in so that we'll
what I'm trying to say is that we incorporate the drug that we calculate as the volume required per day over a period of 5 days into a carrier. Usually the carrier that I use is vegetable oil. It can be power oil, it can be whatever oil, vegetable oil, which is usually administered as 18 mil per kg of feed. So even if your feed is less than 1 kg, you can still calculate the volume of the carrier, which is oil. You now incorporate your antibiotics with that, mix very well, and then spray that on the quantity of food it will attach to it. You hair dry, and then you feed to your fish. That's what we do. Yeah. In developed world, you send the dosage of the antibiotics. That was what I was taught in Germany. When we make our diagnosis, we recommend our treatment. If it's antibiotics, we send it to the feed mill. The feed mill we incorporate directly, but we don't have that in Nigeria. So what we do is that we incorporate ourselves. We do that by ourselves using a carrier that we mix together with the antibiotics and spray on the pelleted diet or extruded diet. But you must be careful to take into consideration the concentration of the drug, just like I said in the lecture, the biomass of the fish, that's the total weight of the fish, and I think the dosage. That's it.
Yeah, those that want to get this topic, we will stream by this time tomorrow on YouTube, please, and we will send it across the board. Fortunately, we couldn't stream direct on YouTube because of technical glitches all over the places. So we will get it, edit it by tomorrow. We will see what we can do and send it. So you have everything you need, verbatim, including all this discussion. Do we have anybody who wants to pep up this talk? Shade is got tired of the glitches she's facing, and I think she had dropped out. She has. Okamaka Nwokolo. Is it Okamaka Nwokolo? You have anything to tell us? Huh?
How do I do that?
You said? Okamaka, unmute yourself. Is there anything you want to share with us?
Yes, sir. Good afternoon, everybody.
Oh, good.
I just came online, but I was able to pick some things that doctor was saying. But my concern is the incorporation of these antibiotics, mixing the antibiotics with the carrier. And then if you're calculating the dosage, are you calculating the dosage of per kg of the fish, or you're calculating the number of fishes in the pond?
It's the total biomass. Total biomass is the weight of the fish multiplied by the number. That tells you the total biomass. The average weight of each fish multiplied by the number.
Each fish.
And then the dosage of the drug. I told you, for example, enrofloxacin and ciprofloxacin is 50 milligram per kg of the body weight. So with that, you get the quantity in milligram, and then you divide with the concentration of the drug. 20% ciprofloxacin is 200 mils in 1 milligram. 200 milligram in 1 mil. Sorry, 200 milligram in 1 mil. So if you divide with 200, you will get the quantity in volume.
Okay, sir.
Did you get that?
Yes, I got that. Then if you are calculating with the you are mixing with the carrier, which is the oil, is there any particular
Yes.
oil that is advisable or any kind of
I
oil?
use vegetable oil. I use the commercial vegetable oil. You can use red oil.
Okay.
It depends.
How long will you
Yeah.
allow
But the oil must
the
be
mixture?
18 meals for each kg of food.
18
It
mil.
shouldn't be more.
Yes. Okay.
Per
Yeah.
kg of the food.
Okay.
And you need to calculate the quantity of food that you give to your stock to be able to get that. And you have to treat for 5 days.
In medication, will it be, you feed fish like 3 times a day?
Yeah. The quantity that you feed in a day.
The medication we have to, yeah, okay.
The quantity you feed in a day will be the dosage for that day. We carry the dosage for that day. You can now divide to 3.
How long will you allow the fish to be under the sun before you medicate?
You don't put the feed under the sun, you air dry.
Okay, you air dry so that everything penetrates inside the meal. Okay, I get that.
You air dry.
Yeah, thank you so much, sir.
You're welcome.
Yeah. You're welcome.
Thank you, sir.
Oladosu, you are going to join us in the Bluebird family, where we are developing a lot of concepts. And nobody discusses politics, nobody discusses religion. It is strictly a professional platform. Yes. And
I'm ready to join.
Yes, please.
I'm not a politician, though I'm a pastor. I restrict my preaching to the church.
Yes, please, because we are looking for some areas we can plug, loopholes we can plug in the system. From being a non-state operator, we've done a lot as non-state operator, because we are merging a lot of eggheads together at various platforms, various brackets. Call it generational, call it age, call it gender, call it religion, call it politics. We are all mixed up, and we are brainstorming to see how we can move our profession forward. Yes. The level of unemployment is so high. It's so high. But the only thing we know is that we cannot suffer in midst of plenty. And that is why, as information is the key to survival, we are trying to let out the steam, bring up the information. You can see how the platform we have now, anybody at any age can discuss, can talk, can advise. And we have a lot of resource persons we have lined up that will come and talk to us on diverse areas in this industry, so that we can put off or pull off the lid from our eyes. So we are just step by step. And I thank you, sir. Honestly, we are highly impressed. You say everybody is asking for the info, where to get the information. We'll package the information and throw it out. We are not in court, and we will never be in court. We don't do things behind the scenes. We do things in the open. Were you there, Dr. Oladosu, when I was your guest lecturer? Hello? Were you in my audience?
Yes.
Okay, you were in my audience. That was in 2000, when I spoke as
the induction ceremony for
yes, in 2022.
Yes, I was there.
Yeah, 2022, precisely 20. Yes. So you can see the way I spoke to those young minds. The way I spoke to the young minds. I have another one from Gbola University in October. Right now I'm in Scotland, but I'm coming back to handle that one in October. You see, this is the way we are trying to see whether we can catch them young. And we are seeing a lot of deficiencies in the school system. And since we are seeing it, we'll just go there and drop it verbatim so that we can move forward. So in absence of anything, I think our Ashari had dropped out. Chika, do you have any other thing to say as the moderator so that we can move and
thank you, my colleague and friend, Dr. Oladosu. Both of us, we are in the same class at the college program in Ibadan. Yeah. And yes, and I know his background in Arak and Nyoma has really made him the right man of the moment to tell us about his experience. You know, Nigerian education is filled with a lot of theories, but today we have had a man who has gone around almost all the water bodies in Nigeria, sampling fish, water, and soil sediments, looking for things that will affect aquatic health. So we want to appreciate Dr. Oladosu, and thank you so much for the enlightenment. We are so happy about the education, and we'll continue to collaborate. In fairness to the federal ministry, the Aquatic Animal Division, 2 weeks ago, they sent us some platform, some templates to fill in some of the things we would like in the Aquatic Animal Division of the new Ministry of Livestock Development. And I was able to send in something. I know some other stakeholders like Oladosu would have sent in some things also. So they're articulating what is going to make up the Aquatic Animal Division of the new ministry. And good enough, the permanent secretary is also a colleague of ours. So, BBC, we are glad you are pioneering and putting up this platform for enlightenment, collaboration, the effective communication to improve, to build capacity that will improve our veterinary services in Nigeria. So we want to thank you and thank everybody who has stayed up till this moment to be in this education, in this educative platform and forum. Dr. Oladosu, you still take more questions because people are going to bombard you with questions, and then we'll continue to work together to build up the aquatic animal component of our veterinary education and services. Thank you so much for the work you've done this morning. We thank God, and I wish all of us a beautiful weekend. Play safe and stay safe in this time of protests. And let's build a better Nigeria.
Please mute yourself. Mute yourself. Somebody is talking. Mute yourself. Background, please. Yeah.
Thank you so much. Thanks for having me.
How can I unmute this boy?
Thank you so much. I really appreciate the effort that has been put into ensuring this training seminar. And like I said, I'm open to collaboration. I believe that we will be able to move the industry forward, and our profession will continue to thrive. Thank you so much. Thanks for having me.
Yeah, thank you. Dr. Chika, please, he was calling me BBC. That was the name I used. They used to know me at school.
I'm telling them I knew you from that time.
Yes, that's my. And when I came out, I formed my company with a blue button. So on this trade, I think we're becoming noisy. And let us end. Oladosu, I'll get back to you later. Oh, we will talk.
All right.
Okay. Thank you.
Thank you very much.
On behalf of myself, yes, Dr. Amine, and Dr. Abwese, three of us, we are the anchors of this particular session. Though we have another session for the speaker, anchored by a set of people, including me. On behalf of three of us, I say thank you. God be with you again until we meet again.